So our international help project is providing clean water to refugees that are in the Syrian camps, the refugee camps in Turkey. So Kim is going to give a description of the problem with supporting information, and I am going to be talking about an overview of our intervention. And my name's Jordan Duncan. So we'll be working with the WASH implementation program, which stands for Water, Sanitation, and Hygiene. There are many world programs that are implementing WASH in developing countries. Some of those are the International Medical Corps, UNICEF, USAID, and the UN. UNICEF has said that, quote, the overall objective of UNICEF in the area of water, sanitation, and hygiene, or the WASH program, is to contribute to the realization of children's rights to survival and development through promotion of the sector and support to national programs that increase equitable and sustainable access to and the use of safe water and basic sanitation services and promote improved hygiene. The goal of our implementation is to change the lives of Syrian refugees by teaching them the importance of clean water. If these refugees have access to clean water and the knowledge that clean water can prevent diseases like cholera, E. coli, dysentery, Legionnaires disease, typhoid fever, and guinea worm, just to name a few, then they can improve their lives and their living circumstances. We believe that it is important to educate the children because they will be more willing to change habits and hygiene practices. We also believe that children have the right to access to clean water to drink, to wash their food in, and to clean themselves in. UNICEF is working specifically with women and children, especially girls, because they are traditionally responsible for collection and domestic water supply and sanitation. We will work together and develop clean habits that can save lives. We will teach the children how to wash their hands with soap and explain to them the importance of washing their hands after defecating, before eating, and preparing food. Our ultimate goal is to help these refugee children gain knowledge of clean water and develop habits that can keep them and their families free from disease.
So my name's Chris. I'll be discussing why our intervention will help solve this problem. Our intervention will successfully help ensure the well-being of refugee children because it is based on sound strategies with many levels of support. In 2002, the World Summit on Sustainable Development set goals for providing safe water sources to people who did not have access to basic sanitation. Also in 2002, the United Nations formally declared access to domestic water supply a human right in and of itself. This has paved the way for communities and governments to tap in to help their local populations on a scale that may not have been possible before. The 2000 Millennium Declaration has committed governments around the world to a clear agenda for combating poverty, hunger, illiteracy, disease, discrimination, and environmental factors. Our program is linked to people's livelihoods and sustainable development in general, and therefore falls under all main aspects of action in this plan. Inadequate and unsafe water, poor sanitation, and unsafe hygiene practices are the main causes of diarrhea, which result in at least 1.9 million deaths in children under the age of 5 annually. Emerging evidences are linking better hand washing practices with reducing incidence of acute respiratory infections as well. Similar programs that combine improved sanitation and hand washing facilities can improve the health of children for life. If properly integrated, these can lead to positive changes across communities. These other projects have also proven that safe water sources near homes reduce time-wasting drudgery, and provide opportunities for poor families to engage in small-scale productive activities. Improving living environments with access to sanitary services is linked to well-being, but also to the dignity of families and communities. The following are some economic benefits. The value of illnesses avoided comes to an estimated $7.3 billion per year. From lower morbidity and mortality rates, an annual global value of almost $750 million is added. And from time saved from having water supplies closer to homes and toilets nearby, this increased production, higher school attendance, and more leisure time is valued at an annual amount of nearly $64 billion. The economic benefits would therefore range anywhere from $3 to $34 per $1 invested, depending on the region. The World Health Organization, a study from which these figures were taken, shows that remarkable additional returns would accrue if simple household water treatment accompanied the drinking water and sanitation improvements. These are some examples of benefits already seen from similar interventions and illustrates the network of invested groups that are primed and ready to help continue implementations of these types of projects.
All right, and my name's Madison, and I'm going to be going over how we plan to implement this intervention. So we plan on implementing our intervention in Syrian refugee camps in Turkey by taking the problem, which is a lack of access to clean water and sanitation facilities, and joined forces with the organization UNICEF and their up-and-coming program called WASH. Through their efforts, we will be able to coordinate with all the aspects of taking this intervention to the people in need. We will work on a timeline of how to gather the supplies needed, as well as the volunteers needed, and funding the budget to make this intervention a reality. We will begin with educating the refugees about the importance of sanitation and how improving their hygiene will promote a healthier and safer environment for all. Then we will begin to implement the WASH program from UNICEF, which includes the provision of water supply and sanitation services that are complemented by the promotion of improved hygiene behavior and supported by the enabling environment. UNICEF continues to promote affordable, safe household latrines. And the more we can educate and instill the importance of cleanliness and good hygiene, the more the refugees will be healthier and safer from the diseases that are around them in their ever-changing lives.